I think you brought a really good balance perspective in that there are,
Mm.
some social obligations that we owe to our fellow man. And then
Yeah,
also as
yeah,
an individual, you hear this and say, I'm not gonna accept victimhood as my destiny. But what can I do? What changes can I make? And I know you're going to get into lifestyle changes, and all we can do
yeah,
is our best. And God
yeah.
honors that and will bless that if we are doing
Absolutely.
our best. Not everybody can do whatever somebody else down the road can do, and getting everything organic and it gets expensive. So we understand that when we preach, organic and stuff like that, that's not meant to exclude anybody. We're all just called to do our best, which brings
Yeah,
us to the question of symptoms of kidney disease. Initial 90% of people must be having little or no symptoms because they don't know they have it. So are you progressed pretty far along when you first start noticing symptoms? What are
usually
those?
are.
And then what are the critical symptoms that somebody listening to this is like, this is serious?
Yeah, for sure. I mean, going back to the fact that most people don't know they have it. 90% don't know they have it because you could almost have 90% destroyed, right? Of when I say destroyed, compromised, you could be down to the last 15% and still feel nothing, right? Um, so it's, and now also before I go into the symptoms, I should highlight too, there are other things. So we talked about modifiable risk factors. Let's not leave off some medications. So NSAIDs, right? Ibuprofen, right? Aleve, naproxen. If you're on those things for a very long time, they can lead to kidney disease, right? This is because these medications decrease circulation or blood flow to the kidneys. Another medication that's infamous is proton pump inhibitors. So a lot of people use things like Prilosec or Omeprazole for acid reflux. If you are on a proton pump inhibitor or PPI, we want to use the smallest dose, just like NSAIDs, use the smallest dose for the shortest period of time, because long-term use can lead to chronic kidney disease. Um, Another thing I would throw in is probably autoimmune disorders. So any kind of autoimmune disease, because of the chronic state of inflammation, that can also lead to chronic kidney disease. But yeah, so now that hopefully we tie that with a bow, the symptoms, right? The symptoms, again, the crazy thing is most people are not going to feel anything until it's too late. Can you imagine, Scott, how sad that is? Like to think you're healthy, and I've had this happen so many times, and all of a sudden, you're told that you got to start dialysis in a few months, that your
Man.
life is going to change forever. It's heavy. It's heavy, and it happens too often because the symptoms seem so benign. The symptoms seem like, you could chalk up fatigue to anything. I just feel tired all the time. I guess I'm just getting old, right? But fatigue, or I would say 70% of people who have symptoms, and if they have symptoms, it's going to be fatigue, low energy.